Hello, my name is Emma, and this is my oral exam. Today I want to talk about my conditioning program that I've made for myself as a result of my postural analysis. My week consists of Monday through Saturday, with things mainly focusing upper and lower body because of the deviations that I have. The things that are most deviated are my shoulders and scapulae and my hips. So every day I have some sort of cardio. It does vary between how intense it is, such as a quick pace Stairmaster and just a walk. And then for lengthening and strengthening, there will be one of those that will be upper body and the other to be lower body, just to give myself a break and also to warm up the muscles that I will be using the next day. As for my fascial release or meditation, I do have some days that are slower with meditations and mindfulness. However, I will usually be doing dome releases or a full body fascial rollout. Now, there are 5 exercises that I want to specifically talk about. The first being hamstring curls. This is for a deviation that you can see from the side. The deviation that it is my left hip has a slight anterior tilt, which means that my quads, which are my vastus lateralis, medialis, and intermedius, along with my rectus femoris, are all short, and the things that are long and weak are my hamstrings, which are my semimembranosus, tendinosus, and biceps femoris. So with hamstring curls, you can do them at the gym, and those are prone or sitting up. However, I'm going to do one with the TheraBand that you can do at home. This is going to be an open kinetic chain because we will be lifting our leg up, and it will be using concentric motion in our glute and our hamstrings. So what you're going to do is you're just going to be in a neutral position, your spine, your hips, your head, and you're going to use your hamstring muscles to bring your leg up to your glute, hold it for a few seconds, and release it from the bottom. The next thing that I want to talk about are lat pull downs. This is due to a deviation from the front that you can see. My shoulders are both slightly elevated, which means my levator scapulae are short and strong, and my latissimus dorsi are long. So this is why I decided to use lat pull downs. I think it's a really good exercise. What you're going to do, again, you are welcome to do this in a gym, and the posture and setup of all of that is basically the same as well. However, I'm going to be using a TheraBand just so you can do it at home in your own comfortable area. You're going to put your hands both inside of the TheraBand, and you're going to lift them just up above your head like this, and you will have slight pressure on the outside of the TheraBand. And using your latissimus dorsi, you're going to use a concentric motion and bring it down. Bring your hands down and slightly behind your head like this. And then you'll lift back up, and you'll do as many repetitions as you need. The next thing that I want to talk about are fire hydrants. This is because of a deviation from the back that you can see. My femurs are both medially rotated, and this means that my internal rotators are short, and those include my tensor fasciae latae, my gluteus minimus and medius, and my adductors longus, brevis, and magnus. And while my external rotators are long, which is my piriformis, my obturator internus, my gemellus superior and inferior, and my glute max and my quadratus femoris. So these, you can use a TheraBand if you desire. However, for less resistance, I'm not going to use one. You will be on all fours on your hands and knees, if you can see me, yep. And then you will use a concentric motion in your glute and your hamstring right here to bring your leg up and then out to the side, and then you'll hold this for a few seconds before letting it down. You want to make sure that your knee is bent at all times, and it will be a unilateral movement, as most of these are, because the hamstrings are, because it's only on one side that is deviated. However, the lat pull downs, as we saw earlier, were a bilateral movement. However, this is a unilateral movement, and so it is also an open kinetic chain, just because you will have things distal to your body. The next exercise that I would like to talk about are seated rows. This is because of a deviation that you can see from the back. My scapulae are both anteriorly tipped, and this just means that my upper trapezius and my pectoralis major and minor are short, and my lower and middle trapezius, my rhomboids, and my I think that's it, are long. And this will be done. You can also, again, all of these are welcome to be done in the gym. However, I just like doing things at home sometimes. So you'll have the band around your feet like this, if you can see it. And you will have your spine really straight. Let me try to show you here. Your spine really straight, and you will pretend that you're putting a pencil in between your shoulder blades, and you'll bring your shoulder blades together in a concentric motion, close kinetic chain, as you bring the band to your chest, and then slowly you'll use eccentric motion to release it again. And you'll do as many reps as you feel necessary. Okay, and the last one that we're going to talk about is the TheraBand hip abduction. This is because from the front you can see that I have genu valgum. This means that I have lots and lots of muscles that are short and long, so bear with me as I try to get through it. But the things that are long are my vastus intermedialis, my vastus lateralis, my semimembranosus, my IT band, my external rotators, which are my piriformis, my obturator internus, my glute max, my quadratus femoris, and also my superior and inferior gemellus. Now that also means that what is long is my adductors longus, brevis, and magnus, my semitendinosus and my biceps femoris, and my hip abductors, which are my glute medius and minimus, and my tensor fascial latae. Now, this one, again, you can use a machine at the gym, but this will be, we'll just use this for now. You will put both of your feet inside, and you can make this as tight or as long as you want for more or less resistance. I actually could do a little bit more, but just for the sake of being adjustable for all of these exercises. You will have your weight over your standing foot, and you'll bring your leg out to the side like this, and you'll feel the burn right here. This uses concentric and eccentric motion. It is an open kinetic chain, and it is unilateral. After you do that, you'll just slowly bring it down, and you can do as many reps as you want. And the TheraBand will be around your calves or your ankles. Any questions are welcome.